Good morning, everyone. My name is Chloe Vaughn. I am a Government and Justice Studies student at Appalachian State University. I would like to thank my co-authors, Ms. Ruby Boyce-Claire and Dr. Barbara Zaitzow. Today I'm going to be discussing COVID-19, the challenges of those living and working in prison. Let's talk about the demographic and crime information statistics. When it comes to gender, it is well known that males make up the highest percentage of incarcerated individuals. But it is important to note that the number of women in prison has been increasing at twice the rate of males since 1980, according to the Prison Policy Initiative. Women in prison often have significant histories of physical and sexual abuse, high rates of HIV, and substance abuse problems. Moving on to race, it is well known that African Americans are incarcerated at a very high percentage compared to white individuals. The Sentencing Project found that African Americans are incarcerated in state prisons at a rate that is 5.1 times the imprisonment of white individuals. In 5 states, Iowa, Minnesota, New Jersey, Vermont, and Wisconsin, the disparity rate is more than 10 to 1. The Bureau of Justice reports that 59% of prisoners are African American or Hispanic individuals. Moving on to socioeconomic status of incarcerated individuals, it is important to note that in 2014, incarcerated people had a median average income of $19,185 prior to their incarceration, which is 41% less than non-incarcerated people of similar ages. When looking at socioeconomic status, it is important to note that overrepresentation in prison populations can cause families and communities of color to be disproportionately affected by the rise in incarceration rates. Moving on to crime and sentencing statistics, 713,000 people are serving time in a state prison for a violent offense such as murder, robbery, crime, and assault. 1 in 5 people are serving time in a state prison for a drug offense, while 227,000 people are serving time in a state prison for a property crime. Let's take a look at the testing data in our state and federal institutions and analyze what those numbers might mean. Approximately 400,000 prisoners have tested positive for COVID in prisons nationwide since March 16, 2020, and approximately 537,000 staff members of prisons have tested positive for COVID-19 since March 16, 2020. When talking about COVID-19 related prison deaths, 2,563 prisoners have died due to COVID-19, and 199 prison staff members have died due to COVID-19. When talking about testing data, it's important to truly understand if the data is reliable and accurate. Underreporting is a serious issue, and state organizations can cause much confusion among testing data, which can ultimately lead to underreporting. Many states, such as North Carolina, do not publish the names of prisoners in its custody who have died of COVID-19. Instead, it announces them anonymously in a practice that is ideally meant to protect incarcerated people's medical information, but instead it makes public health experts and family members alike worried that the system creates a lack of accountability that enables prison agencies to underreport while also downplaying the severity of the virus. And this has left family members confused and has also fueled conspiracy theories along the way. It's also important to talk about the timing of testing, and what we're truly interested in knowing is when they are testing incarcerated individuals. For example, it's important to test upon entry to the prison or upon transfer and movement, and it's also important to make sure that they are testing upon release to ensure that they are not spreading the virus back into the community they will be released into. It's also important to discuss that COVID-19 reporting definitions on agency-based websites are using definitions such as presumed, confirmed, and impending death by COVID-19. All of these different definitions can have an impact on the reporting reliability of the testing data, and it's also important to talk about prison responses to COVID-19 tests. For example, how many positive COVID-19 tests does it take to go into lockdown? And it's also important to talk about the quarantine procedures for positive COVID tests. Moving on to prison-specific challenges, it is well known that correctional facilities house a unique population, as correctional facilities house a population that usually come from a lower socioeconomic status and have had little to no access to adequate health care over their lifetime, which may make them more overall susceptible to the threat that COVID presents. Incarcerated individuals often have mental and physical health issues pre and during their imprisonment. Also, the prison population is getting older, and getting older comes with many other health issues that can also make them susceptible to the virus. It's important to note that right now prisons are having a hard time with staff retention, and with the less amount of staff there in the prison, it can create other serious issues that pose making the virus more likely to spread. When discussing the protocols for prisoners, social distancing is important to discuss. Housing is a serious issue when it comes to social distancing, and it can be very hard to ensure that social distancing 6 feet apart is happening there. Cafeteria and communal areas is also another place that social distancing may be hard or even impossible. Recreation, if they are even getting recreation, it's important to talk about are they social distancing, which overall has a huge response to lowering the amount of the infection rates. Also, waiting in lines for services, such as the infirmary and the canteen. It's important to note that waiting 6 feet apart in these areas can have a drastic effect on reducing the spread of COVID-19. Continuing with prison-specific challenges, for prisoners' accessibility to masks and gloves, the CDC currently recommends 3-ply masks. However, accessibility to masks is important. And also, it's important to ask our questions like, are prisoners required to wear masks in their cells or in their common areas? Those are areas where the spread of COVID-19 is possible, but because those are the areas in which they live, it can be difficult to influence the prisoners to wear the masks consistently. Visitation safeguards are also important, as North Carolina plans to resume visitation on October 1st, 2021. To talk about the safeguards is extremely important, as there need to be specific policies in place to ensure the safety of both visitors, prisoners, and staff members. Plexiglass could be a tool used to ensure that the spread of COVID remains low, and also it's important to note that masks mandates for visitors need to be required in order to protect both the visitor and the prisoner. When talking about the safety protocols for staff, it's important to talk about entering and departing from the prison. That is one of the biggest ways that COVID is coming into the prison is through the staff members, and it's very important to make sure that they are following the guidelines such as wearing masks and gloves, and even social distancing themselves from the prisoners, and also from other staff members. The question of paid sick leave is also important here, because it's important to note that if they are testing positive for COVID-19, are they receiving their paid sick leave? COVID vaccine and testing requirements for staff are also important, as it's crucial to make sure that they are testing staff regularly to ensure that they are not consistently bringing in COVID-19 to the prison system. Moving on to the ongoing efforts to manage the current pandemic, it's important to talk about, is it even possible to follow the CDC guidelines in correctional settings? We talked about the difficulties for social distancing, but it's also important to talk about the cooperation with the 3 W's, wash, wear, and wait. Cooperation with the 3 W's must come from both sides, prisoners and staff members. Testing efforts for both prisoners and staff is important as well, as testing upon entry and release of prisoners is important to ensure that COVID-19 is not coming into the prison, and also that we're not causing a public health issue by releasing prisoners who are COVID positive back into the community. Contact tracing is serious and is important to discuss because contact tracing in prison settings can be very difficult, as relationships between prisoners may spread far and wide across the prison. And it's difficult to ensure that they are contacting everyone who has been in contact with a COVID positive patient. Here it's also important to discuss about the vaccine efforts for both prisoners and staff members. What we have found is there are very low vaccination rates, and that is a very serious public health concern. It's important to discuss how it's possible to really control the pandemic without vaccinations, and the majority of state prison websites are reporting on the number of vaccinations for both prisoners and staff, and those numbers are remaining fairly low. Corrections employees are refusing vaccines at alarming rates, which is causing some public health experts to worry about the ongoing aspect of controlling the pandemic, both inside and outside prison settings. Infection rates in prisons are more than 3 times as high as the general public, and prison staff have helped accelerate outbreaks by refusing to wear masks, downplaying their symptoms, and haphazardly enforcing social distancing and hygiene protocols in these confined, poorly ventilated spaces, which are ripe for viral spread. Bree Williams, a correctional health expert at the University of California, San Francisco, stated people who work in prisons are an essential part of the equation that will lead to reduced disease and less chance of renewed, explosive COVID-19 outbreaks in the future. Along with staff vaccinations, prison subculture is also extremely important to mention when discussing the impact of the CDC guidelines and also the impact of vaccinations. Prison hierarchy can have a significant impact on the ability of the prison staff to enact the CDC guidelines within a correctional setting. It may be difficult to truly influence prisoners to accept the guidelines, such as wear a mask, when the offenders who hold the power in prisons are refusing to do so. Moving on to policy recommendations, we know that COVID-19 may pose a serious and lasting effect when it comes to criminal justice reform. The road to ending mass incarceration is important here as many states are enacting compassionate releases, and they're also enforcing the release of nonviolent offenders. When talking about releasing people from prison, it is important to talk about. Moving on to policy recommendations, we know that COVID-19 may pose a serious and lasting effect when it comes to criminal justice reform. The road to ending mass incarceration is important here, as many states are enacting compassionate releases and also enforcing the release of nonviolent offenders. When talking about release from prison, it is important to talk about the continuity of healthcare after release. It is important to make sure that these individuals are being taken care of, which in turn can cause low rates of recidivism. Another policy recommendation that is important is prison healthcare reform. Timely provision of quality healthcare services can be life or death for prisoners and can also have a serious impact on the quality of healthcare that they receive while in prison. Increased repeat testing of offenders and staff is very important in stopping the spread of COVID-19. If prisoners and staff are being tested at consistent rates, they can ensure that people who are COVID positive are not spreading it back into the prison and also not spreading back into the community. There's also attention to prison-specific changes, such as the increased use of single cells and safer programming that allow efforts to safely continue, such as education, work, recreation, and visitation. All of these have serious mental health effects on prisoners and staff members alike. Access to soap, hot water, hand sanitizer, and face masks for prisoners needs to be readily accessible and safely accessible. Prisoner access to technology, such as iPads, email, and Zoom visitation, is needed to accommodate lockdown procedures. Another policy recommendation is promoting effective national responses that involve collaboration between correctional administrative systems, relevant community groups, government agencies, and national programs for addressing the health, social, and other needs of those who may live and work in correctional settings. And these are the references used for this presentation. Again, I would like to thank the North Carolina Criminal Justice Association for allowing us to present today. We look forward to answering any questions that you may have. Thank you.